Hi, everybody. My name is Brianna Olivares,
And I'm Patricia Doherty.
and today we're going to be talking about some common nutrition concerns for infants. So, the learning objectives include defining colic and describe its symptoms and treatments, describe the etiology and negative effects of iron deficiency anemia and treatment, define diarrhea and describe its etiology and treatment, define constipation and describe etiology and treatment, and describe etiology of early childhood caries and recommendations for prevention.
Okay, so to start off, we're going to talk about colic. And colic is defined as a condition marked by a sudden onset of irritability, fussiness, or crying in a young infant between 2 weeks and 3 months of age who is otherwise growing and healthy. So some of the symptoms of colic include loud or long screaming fits, frowning or grimacing, reddening of the face, and the baby can't be consoled. And so this is even like if you're trying to feed the baby or change the baby's diaper or any type of soothing remedies, it doesn't work. The baby just doesn't stop crying. And then another good telltale sign is that the baby may pull their legs towards their stomach, and usually that's suggesting some stomach pain. And then to talk about some treatments, one could be that you just need to change the formula type. So sometimes some formulas are too abrasive on the baby's stomach and cause some gastrointestinal issues, and that could be one of the reasons. Another way is that you can start rocking or swaddling the baby. And again, this is just another soothing, a way to soothe the baby. And then you can try bathing because sometimes babies like the sound of water. And then you can try positioning the baby well during feeding or birthing the baby more frequently. And both of those are just, again, to try to relieve any type of stomach issues the baby may be having at that time.
So iron deficiency anemia, we talked about this a couple weeks ago. But so as a preface, iron is necessary to make hemoglobin, which carries oxygen and red blood cells and then is then transported throughout the entire body. Iron is also crucial for neurological development during infancy and childhood. So it's usually caused from an insufficient amount of iron in infants, and when infants are usually 7 to 12 months, they should be receiving about 11 milligrams per day. It should be noted that the majority of iron is stored during the third trimester, so preterm infants would miss this point. And other maternal conditions that could cause the onset of IDA is gestational diabetes, anemia, or maternal hypertension with intrauterine growth restriction. Some negative effects of IDA include pale skin, fatigue, irritability, pica, which is the cravings for unusual substances like dirt or ice, slow growth and development, abnormal rapid breathing, and some treatment ideas include taking an iron supplement for the infant. This would usually be given in drops since the baby can't swallow pills or anything, including an iron fortified formula, including more iron-rich foods, or enhancing absorption with vitamin C foods, and that is if the baby has already been introduced to solid foods. And so, as I mentioned earlier, the majority of iron is stored in the third trimester, so this usually lasts the infant about 4 months once they're born. So at the 4 month mark, breastfeeding moms should probably look or talk with the baby's doctor to see if an iron supplement is needed, since sometimes breast milk may not contain enough iron. If the mother is partially breastfeeding, um, that would mean that the infant is also being fed iron fortified formula, so they wouldn't need any iron supplement. And then if the baby is only formula fed, they would also not need any supplementation.
Okay, and then the next topic we're going to talk about is diarrhea. And again, this is something that we've all dealt with at least once in our life. But it's defined as the passage of 3 or more loose, watery stools per day or stool volume greater than 10 grams per kilogram of body weight in infants. So some of the etiologies for diarrhea include viral or bacterial infections, food intolerances. So we've seen this with gluten intolerance or dairy intolerance. Another one is if you change food intake or excessive intake of fruit juices. And then the two main treatments for diarrhea include to just resume an age-appropriate diet. And this could be breastfeeding, this could be formula, or even soft foods, just depending on the age of the infant or the child. And the second treatment is oral rehydration solution. So the main thing with the treatments is that you're increasing the intake of nutrients again and the fluid intake that you may have lost during diarrhea.
Next is constipation. This is defined as the delay or difficulty in defecation lasting for 2 or more weeks, which brings about significant distress to the infant. So its causes could include a switch to solid foods, infants also having weak abdominal muscles, which could cause strain during bowel movements. Constipation is also seen in very low birth weight and formula-fed infants. Some treatment ideas include incorporating water or fruit juice, perhaps pear or prune, incorporating baby food like pureed prunes or pears, and this just increases the fiber to help push out any stool. And then baby probiotics. However, this is starred because there is some hesitation with this method. I did find a study that did show there was an increase in stool frequency as a result of using baby probiotics. However, there is a lack of research with parents using probiotics and long-term effects, if any. So this isn't fully supported yet just because there isn't as much research.
Okay, and the last condition that we're going to talk about is early childhood caries. So the first etiology is the main one, which is frequent use of bottle feeding or sippy cups with formula, juice, or sweet liquid. So the idea behind this is that anytime a child is walking around with like a sippy cup full of any type of sugary liquid, that sweet or that sugar is sitting on their teeth all day long, and that's what's contributing to their increased risk of ECC. So the idea here is that you have the child have the juice or sugary liquid at one meal and finish it at that meal, and then you switch to water for the rest of the day. That way that you're minimizing the amount of time that sugar's sitting on the teeth. The second one is prolonged breastfeeding. Same concept, you just want to limit the amount of time the sugar sits in the baby's mouth. And poor oral hygiene and socioeconomic status. So, and then talking about some of the preventative measures recommended. So the first one, like we talked about before, infants should avoid frequent consumptions of liquids and solid foods with sugar. So again, just try to switch to water for most of the day and then keep it to just meal times, specific meal times, so that you can limit the amount of time the sugar sits on the teeth. Second one is that infants should not be put to bed with a bottle filled with milk of sugary liquids. Again, same concept. And then I also read some research that talks about babies having an increased risk of ear infections if you do that too. So just another thing to try and avoid. And then avoid frequent breastfeeding once first primary teeth begin to erupt. So this is usually around 12 months, and that's when you should probably stop breastfeeding. And that's also around the time that you should be doing oral hygiene. And this is brushing your baby's teeth twice a day with a fluoride toothpaste. And again, at 12 months, you should also be visiting the dentist at this time. But in a couple more slides, I'll also be talking about how you can do oral hygiene even earlier than the first primary tooth coming in. But as you can see with these pictures, I'm just giving you an example of what it looks like for normal teeth, and then what you kind of see if you're developing some caries, which is you see the chalky white spots, or you can see brown spots, and then the more severe cases, you can see real decay. So just so you can have a visual of what that kind of looks like. Okay, and then for some early childhood caries research, so I did find an article talking specifically about bottle feeding and breastfeeding and how it relates to an increased risk of ECC. So first, researchers have found that children who had been bottle fed had a 5 times greater risk of having ECC compared to children who were breastfed. But when you talk about breastfeeding and its correlation with ECC, the studies are more controversial just because you have so many studies that relate breastfeeding with lower levels of dental caries, but other studies that suggest prolonged exposure of teeth to daytime or nighttime breastfeeding as a risk factor for ECC. So the idea here again is just, it's not necessarily that breastfeeding would be bad and could cause ECC, but anytime you leave sugar or milk on a baby's gums or teeth for a prolonged period of time, that is what increases the risk for ECC. So because of that fact, the relationship between breastfeeding and ECC couldn't be established. But again, more research could go into that, but it probably is because of that case. And then just to wrap up this entire presentation, I just wanted to finish off with some more preventative tips for ECC that we haven't talked about. So we did talk about the fact that you just don't let your child walk around with a sugary drink. And again, this is just making sure you limit the amount of time the sugar sits on the teeth. So switch to water as soon as they're done with one meal. And then another one, which I've never heard of before, but it actually makes so much sense, is that you can clean your baby's gums with a soft toothbrush or a washcloth starting at birth. Now, I read this from preventative methods or examples on the Children's Hospital Los Angeles, and this is really good advice because anytime you have sugar sitting on a baby's teeth, even if they don't have teeth yet, it's good to just start oral hygiene as soon as possible and make sure that the baby's mouth is clean, as long just like you would do with a child in brushing their teeth. So another one is, again, once the first tooth erupts, you start brushing the teeth twice a day with fluoride toothpaste. And then the last one is you try to switch the cups as soon as possible. And this is because when they're drinking bottles, you don't want the liquid to just pool around the front teeth as much. And with cups, you don't have that problem. And to wrap this up, the big picture with ECC is that you remember that it is important to take care of your child's teeth, even if they aren't permanent, because it can cause the permanent teeth to erupt crooked or crowded. So a lot of people think that just because their babies don't have teeth yet, that it's not that important to take care of their mouth. And again, even if they have their not permanent teeth, they think that's also, you don't have to take care of it because they're going to fall out anyway. But that's not the case, because if you don't take care of your teeth, even if it's not permanent, then they can erupt crooked or crowded. So it's still could cause some problems. And that's all for this PowerPoint.
Thank you guys for listening.
Thank you.